Welcome to Youthology Radio here on AUK Radio every 2 weeks on Wednesday 6 p.m. till 7 p.m. brought to you by Attentive Social Enterprise. We are your hosts, Manveer
and Ruth.
And we are delighted to have this evening's guest.
It's Kwame.
Welcome to the show, Kwame.
Thank you very much.
How are you doing?
I'm doing well. I'm grateful for the invite.
Thank you, very lovely to hear that.
Thank you.
So could you introduce yourself to your listeners? Tell us about your role and some of your accredited achievements.
Yeah, sure. So as already introduced, my name is Kwame Owusu. I am a pharmacist. I'm a clinical pharmacist. I'm a mental health content creator. I also create content in health. I'm a podcaster. I am an award-winning mental health advocate. And apart from that, I am also about youth empowerment. So that's a quick summary of what I do.
Wow. You said this quick summary, but that sounded like a lot. But in a good way,
In a good way, yeah.
That's amazing, honestly.
So for this evening's show, we'll be focusing on mental health advocacy. Yeah. It's a very important topic in this day and age.
Yes.
And we're still discovering different parts to mental health,
yes,
stigmas, and everything else, and especially with young people as well. It's such a big thing. First of all, I wanted to ask, what is a mental health advocate? Just simple.
So in simple terms, a mental health advocate is someone who actually goes out of their shelf to throw more light on mental health, because we live in a society that we have ended up stigmatizing mental health. The moment that someone starts talking about their mental health, we look at them with their side eye, because we actually end up being judgmental. And we don't blame people for that, because we have lived in such an era that it had not received much attention. Therefore, lots of people shy away from it. So in simple terms, an advocate is someone who just put their voice behind it, want to see the change, want to see people have a better experience dealing with their mental health issues, and also going to the extent of throwing or putting their voice behind by educating people, by letting people get to understand it, because most of this stigmatism boils down to people who do not actually understand it and people who do not know where to find the necessary information to support such a good cause. So that's a simple terms when anyone asks me about mental health advocate.
That's nice. Thank you for the explanation, because not many of us would know what that means, even though we do hear it a lot. Mm-hmm. Can you tell us a bit what inspired you to become a mental health advocate, and how did you get started?
Yeah, thank you very much. In terms of advocacy, before I started mental health advocacy, I had actually been an advocate for organ transplant donation. So I started as far back as I think 2016, when I was actually doing my A-levels, whereby I actually got an invitation from a UCO student who wanted to end up conducting a research in the Black community to be able to end up advocating for more Black people to sign up to the organ donation register. So I attended the seminar, and for the first time, I actually got to see someone who has been a beneficiary of organ donation. So once I sat in that room, I walked out with the mission that I'm going to let other people end up knowing more about it, because even right now within the UK, the Black community is actually the least donors when it comes to blood. However, when you check the register, we are the highest number of recipients. So if more people are not donating blood, which actually matches their blood group, how are we going to get people who are actually going to get the support? So when I actually found out, I realized that there is the need for such voices. And prior to that, I have also worked in the youth parliament. I used to be the chairman of Enfield Youth Parliament, so coming from North London. I actually ended up wanting to become that voice to the voiceless. So all these actually ended up making me always want to be involved, and being part of such an initiative, it ends up going in line with my healthcare profession that I wanted to actually end up getting into. But as time went on, I realized that if I'm ended up advocating for people to join the register, have I myself signed up to be in the register? Do I even understand it? If I'm not able to live by what I'm actually preaching or encouraging people to live, that I need to rethink what I'm actually trying to end up doing, because you don't want to end up coercing, or you don't want to influence people to do something. Meanwhile, behind the scenes, you're not doing it. It's like an influencer influencing you to actually use a certain product, but you go and check behind the scenes, they have not even used it before. They don't even know the consequences. You're going to actually end up looking at them as actually not being fake, and it will make you lose your credibility and your influence that you have over people. So I had to really think about it. And when I really sat down and I weighed the pros and the cons, I realized that I have myself not really understood much of my decision on getting on the register yet. So you know what? Let me pull back. So going forward, around the same time, there's someone that I actually end up following, and she came out to do some weird stuff. That was back in my home in Ghana. She came out and she actually ended up going a bit nude on video, and people were videoing and everything. So we didn't understand at that time. I saw the person was trying to contest for election. So we thought that it's all part of publicity stunt. So 2 years later on, around 2017, the person came out and got invited to one of my favorite TV shows and started talking about the fact that she had bipolar, but she didn't know, like she has not been diagnosed. So it was around that moment in time whereby she started telling about her story, talking about mental health. That actually reminded me of my own ordeal that I had in 2015 2015. I also had my own fair share of going through a short episode of depression, whereby I couldn't tell anyone because I don't know who to speak to, first of all, and second of all, coming from an African background or from the Black community, who am I going to speak to? Because this is something that we've stigmatized. It's a taboo to talk about it. If I come out to talk about it, they're gonna brush it off as if I never lived that experience, and I don't want anyone to brush my experience away. I rather want someone to even if I've actually overcome it, I want someone to, talk me through about it, get me to understand what I was experiencing. So because I didn't know who to speak to, I went on Google, typed it in, and lo and behold, I was actually ticking all the boxes for the symptoms I'm experiencing. So fast forward, I wouldn't have actually told my story until someone closer to me experienced it. Then I was like, at that time too, I was studying that in university. I was studying pharmacy, and that is exactly the topic I was learning. It was a mental health module. So at least I've had an idea of what the condition is all about. And when it came to that, I was like, if I really want the person to heal, I need to tell my story, because that time I've not told anyone my story. My mom doesn't even know that I really went through that. So when I told the person my story, it gave me the confidence, because before then I was just reposting. When I heard about that previous person's story, that really ignited my desire to let other people know more about it. I didn't put my story first. I was just sharing posts to educate people. But when someone closer to me experienced it, I realized that it's getting closer home. I need to start telling my story.
It felt like a calling to you.
It felt like a calling that I ended up saying, because no one had an idea about it. So if I really want someone to understand what you're going through or be supportive, I need to now come real and let the person understand that I've gone through it. I've been able to come out of it. So this success story should also motivate you to, get over it. And lo and behold, it actually started the journey. So I actually started in 2017, making Instagram posts, and the rest is history. Yeah.
Sounds very inspiring.
Yeah, thank you.
And the story itself, it just comes from the place that you've come to a point in your journey where you're not afraid to talk about those things you've been through, because I'm understanding in a cultural sense that when you talk about mental health as well, it's often tabooed and it's often shamed. And one thing I find, when you feel a deep sense of shame that you have a mental health issue, it becomes a thing of, how can I speak out? Yes. Who do I speak out to? And the fact that you found that calling is very inspiring, and
Yeah.
it just adds more to the authenticity of the person you've become today.
Yeah, thank you. And even the time that I started doing it, I had not even seen a lot of people doing those kind of posts on social media. But when I started, as time went on over the past 7 years, I've seen everybody wake up and start reposting these kind of stuff. And to me, I felt like a deep sense of mission has been fulfilled, because when I started, it's not only young people who reach out to me. I've had married people reach out to me. I've had old people I look up to reach out to me. I finished a radio interview like what we are doing right now, and the producer, not knowing he was going through that person could be my father. That gave him that sense of calling and that sense to actually step out to go and actually get checked. So straight after the conversation, the person told me that, you know what, I'm going to actually end up getting checked, because I feel like the symptoms that you are sharing, I'm going through that right now. So it made me realize that by me opening up my story, me as a young guy opening up my story, is going to go a long way of saving a lot of people. So I might as well actually share more about it. Yeah.
Definitely, I think it's very important that you share why you're doing it. It breeds the purpose and it breeds the reason of why you need to keep on doing it, because oftentimes when we start doing something, there's often that motivation that carries it on, but the purpose that comes afterwards makes it even more valuable.
Yes.
Now, I want to talk more about how, in terms of young people. So my question is to you, what are the biggest challenges in the current mental health landscape, particularly for young people, and why is it crucial to focus on youth mental health?
Thank you very much. So apart from being an advocate, I've had the opportunity of working in a mental health trust, which my trust also helps to provide a service, CAMS, which CAMS stands for Children, Adolescent Mental Health Services, right? And during my induction, I had, for the first time, because I've actually been advocating, but for the first time, I went to CAMS and I got to see young people who are receiving mental health services. And these young people are not people who are being brought from home, get a service and go back home. No, they live on site, so they are inpatient, right? And when I checked their age, the youngest is 12 years old. 12.
Wow.
Yeah. 12 years old. You start thinking, and this is the conversation that I always have with my guests, mental health specialists, when they come to my podcast. These are the kind of conversations we have. And like, at the age of 12, what exactly cannot be talked through for this young person to be at home, to have a better mental health? But you boil down it to one, the person might not actually have a great family support system.
Yeah.
Therefore, they end up internalizing a lot of stuff by the time they realize is something that has changed the kind of person they are. They could become violent. And if such a person is within that space, they have to confine and keep the person inpatient to be able to make sure that they actually get the best medical service. Two, it could be due to peer pressure. They might be having a friend, and the next moment they meet, they might be introduced to drugs, alcohol for the first time, and it ends up actually getting out of hand. Thirdly, it could be as a result of being bullied on social media, right? So looking at all these and looking at the youngest age being 12, which most of the time nationally, we look at young people starting to experience these around the age of 15, 18, but as young as 12. It made me actually get to come to the realization that, one, there is not enough mental health services, because my research from the mental health first aid showed that it takes 6 months for them to even see a specialist, not to get help, not to get treatment, to see a specialist, for the specialist to ask, what do you need me for? Or ask, why are you here? Like, what do you need? It takes 6 months. So imagine a 6 months period, a young person is experiencing this. By the time they even get the service, it's a fully blown mental health condition. So some of the challenges is, one, easy accessibility to mental health services, because all these austerity measures and all these cuts that the government has actually ended up having on healthcare, it's going a long way of hospitalizing a lot of young people, which a lot of campaigns have actually been done, but we are yet to actually end up hearing from the government. And also, the government actually recently put out 10 spots across the whole UK it's kind of, they're making it look like a walk-in center for young people for mental health. And it's like the whole of UK 10.
Yeah, that's
It's not enough.
It's not.
not at all.
You get what I'm trying to say? It's not enough. So it shows that there is not much investment being done or being made within mental health services. And with me, I'm coming from the preventative side of it rather than the curing side of it. Yeah, if someone is actually genetically being born with, because there's some of the conditions like bipolar, sometimes it might be genetic, it might be running through the family. So definitely the healthcare service is going to be there, which 100% should be there. But one of the ways that I've come to ended up thinking about is, and that is part of my campaign that I did with the BYC, which is the British Youth Council. I got the opportunity of speaking up on last year, where I proposed the mission that we need to amend some of these mental health laws, which we were actually for the motion 101 about recognizing our minds matter, which is a law which exists. However, we wanted it to go a bit further, whereby young people take part in designing their own mental health services, what it needs to include, what needs to be added, what needs to be removed. Because if you let young people to take much responsibility in these sides, they'll be able to devise something that is going to be beneficial to their fellow young people. It's like someone from a 20th century trying to devise the solution to a 21st century problem, but they've not lived it. It wouldn't help, isn't it?
Make sense.
It doesn't help. So that's what we were trying to actually incorporate. That was one of the campaigns that I was actually part of, and we're looking forward to it being discussed in the parliament. But sadly, BYC, after about 70 plus years, has to be closed down due to low funding or less funding that's available. But we are looking forward to hopefully they reigniting. Maybe this new election that is coming up, the new government will take into consideration of not cutting away young people's voice.
Hopefully.
It absolutely sounds disappointing.
Yeah, it is.
But one thing I kind of find is that there is a solution, and the solution is to evolve the process of what we're doing now.
Yes.
And right now, by the sounds of it, there seems like there's no process at all, or the process seems very broken.
It is.
Yeah.
But some of these processes, advocates like myself, we could actually end up making a difference, because I've started actually reaching out to schools, which some people have started also doing it, whereby my proposal was that mental health education, I know there might be some students or there might be teachers who are listening to our program who might actually argue for my point, or they might actually argue against my point. I know that mental health education is being offered in schools, right? However, mental health education has been done as a module. It's not a subject. Physical education, we all do our sciences. Our science subjects in schools, biology teaches us about exercising. Then we could have said that, oh, biology teaches us about exercise. Therefore, we should actually end up basing on the exercises that we are learning in biology to say that physical education is done. But we have got a slot on the timetable for physical education. If that is the case, then why don't we have a slot for mental health education, whereby we are not being examined on, but it's a slot each week whereby students from year 7 or year 5 or year 4 onwards actually gets the opportunity to be taught to help them to understand themselves, because most young people do not understand themselves, and when it reaches the adolescence, that's when hormones kick in. The young lady do not understand themselves, whereby their body is changing. She doesn't understand why by some guys have started calling her or something. Some of these young guys do not understand why by they end up getting moody all of a sudden. All of these are hormonal changes, but if they don't get the support that they need, these hormonal changes could end up changing them drastically, because someone will come and actually influence them and say that, oh, the mood that you're having is not normal. Let me give you this kind of thing. Let me give you this kind of alcohol. Let me give you this kind of drug. It will boost you, make you confident. You can speak to the girl. What are they doing? They are teaching them how to use drugs. But if mental health education is being put and is being reinforced, though they're teaching in civic education or anything, but the people teaching it might not have, one, had the lived experience, two, might not have all the necessary facilities to be able to make it very, very like effective to students. Therefore, every time you raise this conversation, people are like, oh yeah, no, they are being taught in school. But the thing is, they are being taught in school. Is it being effective? Current figures are showing that it's not being effective because we've seen a lot of young people. The number keeps on rising and rising. The amount of young people who are being admitted into mental health services. So it's high time that we need to step back and see what measures needs to be done. And education or schools are the places whereby students spend their formative years most than family. If family is not talking about it, school is not talking about it, who is going to talk about it? No one is going to teach them. They have to go through the experience. And it's not every single person who go through the experience and is able to come off the medication. They have to live with it for the rest of their life. So if we can actually help by starting the education early, then I believe it will make a very big difference.
Yeah, definitely. And because we are on the halfway point of the show, this is such a good note to end on. Thank you for this point, Kwame. You've explained the whole deal and your workings and some of the solutions and understanding how mental health problems can manifest in young people and the steps to solve them.
Okay.
So in this segment, we'll be addressing the issue of why young people don't vote enough or why if young people don't want to vote at all. So, Phil, I'm going to give you the mic here. I want to ask you, what are some of the reasons from young people being disengaged from voting or not wanting to vote at all?
Right. I think when a young person living at home with his mum and dad sees his older brother and older sister turning 30 and still living at home because they're not able to afford, to buy their own places. And if they wanted to buy their own place, would have to save a deposit. And in order to do that, they have to stay at home because the rents are so high. I think all of that type of thing just disillusions young people, and perhaps they're not believing so much in the dream,
What about you, Kwame? What do you feel? Why do you feel like young people don't vote, or why do you think they're disengaged from voting?
A lot of young people have actually come to the realization that no matter their vote, it doesn't actually make a difference, or it does not even being taken into account. So I don't know if this thing is still there. We used to actually have the UK Youth Parliament, which I had the opportunity twice to represent my borough. It helped us as young people to be able to discuss issues, real life issues that are affecting young people. And all these are taken into consideration, whereby young people felt their voices to be heard. But over the time, it has actually been taken away from them. For example, the British Youth Council, which had actually been existing for 70 good years plus, had actually closed down during this government's reign, right? So it's making young people feel like everything that belongs to them is being taken away from them. However, there came an era whereby there was a very great turnout when it came to general election. That was when one of the political parties, Labour Party, when Jeremy Corbyn was the leader, actually proposed that students' finance, he's going to actually end up reducing students' finance because students' finance has become a burden to a lot of young people who are going to university because they don't want to actually end up coming out of university paying 9,250 times the number of years that they collected the loan for, come back home, there are no jobs, and it will be some amount of debt on top of them, because until you start earning a certain amount of money, that's when you're going to start paying, right? But they want to enjoy the money for themselves, because prior to the 9,250 that the Conservative government actually proposed, lots of people were paying it as low as that. I think it was 2,000 something at one point in time, and it got skyrocketed to 9,250. So when he proposed that, and he had some of the young voices like Stormzy coming on board and speaking, and people voting for Jeremy Corbyn, unfortunately he lost. So it made a lot of young people feel very hurt that upon all the effort that they have actually put in voting for Jeremy Corbyn, he still lost the election. So what is our way out? So they've made them, a lot of them actually throw in the towel. You get what I'm trying to say? So unless young people start to see a change in the vote, start to physically see that there has been an impact on the leader they choose on their lives, I believe it's going to even go worse. But for me, I have voted since I turned 18 till date. I've always voted because I have this mindset that if I end up not turning up to the polling station, someone else somewhere who still believe that even if they end up actually voting this particular leader in, is still going to be our prime minister, then I'll rather cast my leader, even if he doesn't win. I know that I contributed in making a decision for myself. So even if he doesn't come, I still have someone I trust in. So I believe it is become, as Phil was actually adding, is they not seeing, we as young people, not seeing the effect of the kind of leaders that we choose. Because right now, there are young doctors, junior doctors who have just qualified and are on the street protesting. Why should they end up protesting? But before they went to the medical school, they might have actually told them that you become a doctor,
True.
you end up getting
Yeah.
this amount of money, this and this and that. But upon doing all this learning, getting all this prestige, having the title as a doctor, they have to still negotiate how much they get paid. Then it means there's something wrong. You get what I'm trying to say? There's something wrong. So they have to fight their way out. And if you realize, there is a whole lot of effect on the NHS, because that's where I work. And even us as pharmacists, we experience it. Young people have started finding their way out. Where are they going? They're going abroad to go and work. So where is the future? So I 100% side with what Phil is saying about that. If someone turns 30, they see that your older brother staying in the same house as them, they don't see their life moving forward, they have not got their mortgage, they feel like life has actually come to a standstill. Therefore, what's the point of they going out to vote for a leader?
100%. That made perfect sense the way you broke it down. And I think it resonates with a lot of young people in the way that we feel like even if no matter what we vote like or what our votes are, it doesn't get taken into consideration, because if the person we're voting for is still not chosen, then what's the point?
Yeah.
Which brings me on to my second question, which is, how significant is it for young people to participate in the voting process?
I believe...
So first of all, ask Kwame.
Yeah.
So I believe young people, no matter what, needs to get themselves involved in the voting process, because voting, it is their right to actually end up voting, and they've got the freedom to actually end up voting. Voting, most often, it doesn't come how you want it to come. It's like we all watch like X Factor, all these competitions. You might vote for the person you believe should go home and being crowned as the winner for this, but at the end of the day, they end up not becoming how they wanted to actually end up becoming. The same thing applies to election as well. The more that we come together as young people to vote, the better. Why am I saying this? Because these people that we are voting in place, they might not understand our generation. But the moment we start voting, or the moment we start encouraging young people to get into politics and be in parliament, it starts from one, it starts from two. The moment you get about 20 young people who are MPs in the UK, we're going to see a change. Why? Because they have taken a certain percentage of the regular number of people or young people who get represented in the parliament, which recently, I think the youngest person in parliament is Nadia. She is actually a constituent. She actually ended up having her constituencies in Nottingham. She's very vocal. She speaks for young people. Imagine we have 10s or 20s or 30s of Nadia putting themselves in front. We're voting for them. The whole status quo and the whole dynamics of politics and young people's representation is going to drastically change. So my encouragement to young people is, don't leave yourself out of the voting process. If you feel you've got an idea, bring forward the idea, stand for the election, because I think from 18 years onwards, I stand to be corrected, you could actually end up starting for election, because we want young people more representation, and the more representation, the more that all the policies that are being made are going to be effective on young people.
Definitely. I think that from your point of view, it's more like we need more representation. Votes just don't count. Votes is just like one part of the pie. It's the whole. We're looking at the whole thing.
And the representation is part of the voting process, because if you don't start voting and you don't start seeing how Parliament is being run, how this whole election process is being run, how are you going to know that we should put this person forward to represent us? So by getting yourself involved, in choosing a leader and representation, it also to do with the voting. Because if today, on the 12th of July, you turn up to go to your polling station, you vote, you want to see the outcome of your vote, right? So if you voted for someone, you want to know, did the person win or not? Why did the person not win? What fell short? So if we are bringing out a leader as a young person, we know the kind of person we need to put out there to be able to gain all the votes from one political party to that particular young person for them to vote or for them to win in that constituency. As time goes on, the young person actually start climbing up the ladder. Who knows? The next moment, the young person that you voted for is a prime minister, which means you have actually ended up contributing in choosing a leader that represents you.
Phil, what do you feel about young people? Why is it important for young people to vote?
Well, listening to what Kwame just said, I think it's really important that people understand how it works and who's doing it. It's interesting that going around the Sixth Form College and speaking to some of the students I come into contact with, many of them aren't even conversant with the difference between the left and the right, or the Tories and Labour. They're not clear. And you hear comments like, they're all the same. Now, I understand that perhaps the view of some people could be that the politics are so similar that they can't differentiate between the two of them. But I really think it's important that students engage with the process. I mean, for example, if I can use the Brexit experience, now it was a 48 to 52 split across the nation. But if you look at the split, I believe that I'm right in saying that the 52% was comprised of predominantly the older part of the population, and the remainder side, the 48, were all the younger people, or predominantly the younger people languish. Now, I don't know how many 18-year-olds or 18-pluses came out in the referendum and made their votes count. But if you didn't, then the result was the 52% took it. Now, I don't know what, in real numbers, what that number really was, but I believe we're talking about less than 50% of the population came out and voted for that referendum. So if young people had been more active, then the chances are your European travel and all the benefits of being an EU member state would still be intact. But as it is, the older generation ran away with the results. So for this and many other reasons, the one thing I've got to say to young people, especially those that say to me, "Oh, I'm not really interested in politics." Well, unfortunately, everything is political. Everything. I mean, there is not a single comment from the cost of your bus tickets, whether or not your bins are emptied. It doesn't matter what the issue. Politics is involved somewhere along the line, and it's really important that young people engage with it because they cannot avoid the consequences of the decision makers. So be a decision maker, get involved.
Definitely. I think the example that you gave for the EU referendum is a very big one. And just the way, like, if the statistics are obviously true about the voter turnouts and the voter ages, that means that young people and the younger demographic can definitely play a big part in the elections and future elections as well. Because within the European Union, I do remember I was very young. I was obviously younger than 18. There was a lot of media attention about being out of Brexit or staying in the European Union, what that's going to look like, and all these other things. And one question I just want to ask is...
And before we go to the next question, just adding to what Phil just rose about the EU, a lot of young people do not know that Right now, if you come to pharmacy and you come to purchase certain medication or you are being given a prescription, the reason why some of these medications are not available is because of the decision of the Brexit. Because most of the medications that we are getting or we are being given from the NHS are not produced in the UK. They are coming
Okay.
from abroad, as far as Germany and other European countries. For them to cross the border, there might be some tariffs, which is going to cost a lot. Therefore, if it's not going to help, then obviously the medication is not going to be available. So sometimes we don't have certain medications for a longer period of time. We have to wait because the EU has actually made that law, and unfortunately, Britain do not actually stand to gain. So that's one of the disadvantages or one of the effects, knockdown effects we are having.
Wow.
Yeah.
So, Manveer, can I just add also, the big question I think that may face young people if the Tories are returned, which is probably unlikely, but is, do you wish to partake of national service?
Exactly. Go to the
what
army.
does that mean? What does it look like? I mean, are they going to be conscripting our young people into the army? Is it just a case of doing some charitable work? I mean, what does it mean? I think it's really important that young people do not just sit and watch it happen. Get up.
Go for it.
If you are interested in national service, and you may well be, well, get up and say so. But if you're not interested in being directed by the government in national service, then again, get up and make your voices heard.
Definitely, I think what I've found here is a sense of it doesn't matter if you feel like if you're unhappy about things, it becomes our responsibility as young people to be like, no, we're not going to allow this. We're not going to tolerate these things. We have to make our vote count and obviously represent ourselves in politics, not just being someone that has studied politics, but understanding just like...
And it's not like young people are not interested in politics. Young people are really interested in politics because if you come on social media, a lot of young people are sharing their ideas. Oh, what about this? What about that? Because I follow this page on on Instagram. It's called UK Politics Facts or something. That page, when you check the comment section, is full of young people who are commenting. Just imagine about 500 young people engaging to this post and these 500 young people not turning up on the 4th of July to cast their votes. It's going to go against us. Both political parties have got their ups and they've got their flaws. But look at the ones whose policies do favor you. All the time it's about looking at their manifesto, looking at their track record. We've had 14 years of conservatives in power. Let's be honest. In which part has it actually benefited us? They've had about 5 or 6 leaders going back in and out. Are we going to have another time of another Tory leader leading us in this 2024 election? It's in our hands. We have to turn up because we've seen the effects happening across whereby the Tories are losing a lot of their seats. For example, in Essex, for the first time in history, Terrock, it's always been a Conservative seat, but for the first time, Labour has actually won. Labour is winning. We are not saying Labour is the best political party, but at least we want to see a change. We want to actually see the true values which reflect on young people, adults, healthcare professionals. We want it to reflect because the state as we are in, people do not come to see it, but the waiting list when it comes to NHS is getting taller and taller. Because just, I think either this month or next month, the doctors are going back on the road. They're coming out again to come and protest. How many protests do we need for doctors to know that this is the job I've signed up to and I need to get the best pay? So, young people, we've got a decision to make on the 4th of July. Let's all turn up and make that big decision.
So, just to wrap up there, because we are on the end of the show, the final message of this show is everybody's vote counts.
Yes.
Whether you're young, obviously it's very important that we as young people vote. It'll be some of our first times voting as well.
Yeah.
Whether you're young, whether you're old, whether you're middle-aged, it's important to vote and make sure what you want and what you want to happen actually happens. Obviously, sometimes things won't happen the way they do because politics is something complex.
Yes.
But as long as you put a voice out there, it's very important. So on that note, I would like to thank our guests, Kwame
Thank you very much.
and Phil, for being on this show and giving your very valuable points. And this has been Youthology Radio here on AUK Radio on every 2 weeks between 6 p.m. till 7 p.m. We have been your hosts,
Ruth?
and Manveer Singh, and we wish you have a lovely evening.
And